My name is Catherine Sines, or Katie, and today I'm going to be doing the med administration pass, and we're going to start. So the Dr. Adams has ordered us to give Lulu Basili her medication for today. We're giving her 9 o'clock medications, so we're going to start at the med cart. This is my med cart in this general area right here. I'm going to unlock the med drawer with this key, and I'm going to pull out her drawer. And this does say Lulu Basili, and it even has her birthday 4/17/1936 on there. And her medications are in here. So we're going to check her allergies. It doesn't look like she's allergic to any of the medications that are being given today. She's allergic to codeine, and today she's not going to have any kind of opioids at 9 a.m. She does have an opioid on here, a Duragesic fentanyl patch for later. That is an opioid, and I will consult with the provider making sure that she is not allergic to that medication because it is in the same class of an opioid. So I would want to make sure that she's not allergic to that. And then I'm gonna check the chart one more time. This is Lulu. Her drawer matches her chart, and it also says Lulu on there, Lulu Basili. And it looks like she has constipation and pneumonia today. So we're going to be giving her 9 o'clock medication. Her 9 o'clock medication starts with the Ducasate sodium or the Colace. And we're gonna find that in here. And this looks like the Ducasate sodium, 50 milligrams per oral daily. So that's what we're gonna give her today at 9 a.m. because we always wanna do the 6 safe med rights. We're gonna do the right to patients, right medication, right dose, right time, right routes, and right documentation. So all of those are very important because when you're doing the right patient, you wanna make Lulu Basili is on everything that you do. And you're looking at the right dose, the right time, the right route, and the right administration and everything like that. So those are our 6. And then, so we already checked the Ducasate sodium Colace, 50 milligrams per oral daily. And that is going to be given today at 9 a.m. This is the lisinopril. And it does look like it says 10 milligrams per oral daily on there. And I checked both, and this medication is not expired, and nor is the other one. And then we're gonna pull out the furosemide, 40 milligrams per oral daily as well. Let me check for that one. Okay, this is my per oral daily right here. This is our furosemide per oral daily. And it looks like it's already prepackaged for us. So it's 40 milligrams right in this little package already done. So for that one, we will have to check her potassium level and make sure it is less than 3.5. So let me take a look right now. Yeah, so it looks like on her blood work, her potassium was below that. So we're safe to give that today. Okay. So now we're going to check for the magnesium hydroxide or the milk of magnesia. They want to give 30 milliliters, 1 dose in the morning. So that would be our 9 a.m. dose. And this is my magnesium hydroxide. Okay, so we pulled out all 3 medications. We're going to do our second check now. So this is our Ducasate sodium or Colace. It's 50 milligrams per oral daily. So it's 50 milligrams per oral daily Ducasate sodium, and the expiration is good. So that's done. Then we're gonna take out the lisinopril, 10 milligrams per oral daily, 10 milligrams per oral daily, and that is good as well. And then we're gonna check for our second check for the furosemide, which is the Lasix, and this is already prepackaged, so it is 40 milligrams per oral daily. And we did check that potassium level, but I'll take a second check too. Yeah, looks good. So, and then this is our magnesium hydroxide or milk of magnesia. They do want 30 milliliters of this in the morning. So we're gonna measure that out right now. because we can't take the whole bottle with us to the room, unfortunately. So we will have to do our third check while we're here. Okay, at the med desk. So this would be my table. It's kind of hard to tilt it down. Oh, I can do that. So we would want to measure it to eye level, 30 milliliters. So we're gonna pour it in. We're gonna shake it first because it is a suspension, and then you do want to put palm to the label and then pour it at eye level. So we're gonna want to pour it out. There we go, that looks like 30 milliliters. Okay, we're gonna put it back now. Okay, so this is our milk of magnesia. So we're gonna do the third check for the ones we can't bring with us. So we do have the docosate sodium. Let's check that one more time. It is 50 milligrams per oral daily. Gonna take that out, make sure it looks okay. Yep. And now we're gonna place it in our cups. These are gonna be my cups because I didn't have a chance to run to the store and get the paper cups. But this is my cup, and that is all set and ready to go. I'm gonna put it back in her drawer. And then this is the lisinopril, 10 milligrams per oral. Yep, right on there, expiration's good. I'm gonna take that out. Here is my cup for that. And then let me make sure this is okay. We will put this in a cup. This one we're gonna do in the room. So we will do that one when we meet our patient today. So that one's good. And then let me make sure everything's good on here. So the magnesium hydroxide, 30 milliliters, the expiration's good, and we're gonna do our dose now. That's our third check for that one. So I level this one more time. Yeah, looks good. So we have all three of our medications down here. These are our three that had a check today, and they are all good. And then this is the third one we have to check in the room. So we are going to go to the room now. Let me put these away. Okay. Oh, and I did wash my hands before doing the medication, and I will wash them again before we meet the patient. I will, hold on. So here is Lulu's chart. Here's Lulu's bin again. Has her name on it. Right medications are going in the right bin. Gonna put them back in the med cart, and I'm gonna lock them up. So they are locked up. So these are good. I'm gonna stand up now. My knees hurt. Ooh. Okay. So let me wash my hands now that we're done putting everything away. So wash them in the sink for 20 seconds. All the right areas. Okay, now we're going to the patient's room. So let me take my medication. Let me grab a cup of water for her to drink. I got a Coca-Cola. This is water. Don't have a cup. So here's my medications and everything in here. Okay, everything's locked, everything's safe. We're off now. Oh, one more thing. And if this patient did require us to crush up their medication, we would crush up their medication in between 2 little cups, and then we would mix it in some applesauce for them. And then if the patient did need the other thing, hold on, brain fart. Oh, and if the patient's medication did come from a shared bottle or a bottle that contained multiple doses, I would use the lid to get the appropriate amount of medication out of the bottle without touching it. If I didn't get the right amount, I would pour it back in. So that's how I would do that. And when I crush the medication and I use the applesauce to feed it to our patients, I would make sure they were all in individual cups and labeled with their name, their date of birth, and what kind of medication it was. So I would do all those things if they did need their medication crushed up, but luckily the patient we have today does not. So now we're gonna go off to their room. Hello. Hi, my name is Catherine Sines, and I will be your nurse today. Could you verify your date of birth and your name for me? Perfect. Okay, so let me check your wristband as well. Okay. So looks like everything matches up. I do gotta do my third check real fast. And then we will start. So the third one I have to check is the magnesium furosemide, which is the 40 milligram by mouth. And it does look like it says 40 milligram, and it is not expired. So that's all right, that's set. All the medications are done. Okay, so we're gonna give our patient a drink of water, make sure they can swallow. Can you swallow this for me? Good, good. Okay. My patient is a Pikachu. I couldn't find anything else. Okay. So I'm going to be giving your docosate sodium or your Colace. It is a laxative and a stool softener. So that's what it'll be doing for you today. It'll be softening your stool. If you could go ahead and take that for me. Great, thank you. And then follow it with some water. All right. And now we're going to give you your lisinopril. That is an antihypertensive, and it will relax your blood vessels and allow your blood to flow a lot better. So you'll start feeling better today. Okay, thank you. And then we're going to do the furosemide or the Lasix. That's a diuretic. It'll help you get rid of some of that fluid retention. So you might urinate a little bit more, but that's normal, okay? So I'm going to open this up and put it in a cup without touching it. All right, here you go. Thank you. We're going to give you some water. All right, you're the best. Okay, and then here's your magnesium hydroxide. This is another laxative, but it's also an anti-acid, so it reduces the acid in the stomach, and it'll increase the water in your intestines to help you pass a little bit better, so we can get rid of that constipation. Okay, Lulu? Thank you. I know it must taste awful. Let me give you some water to wash that down, okay? I'm sorry about that. Okay. And then I did wash my hands again in the beginning of this as well. Okay. All right, so that's all today. I will see you again later. Thank you, Lulu. Here's your call button, and let me put your side rails back up. If you need anything from me, just holler. I'm not too far. Okay, Lulu. See you again later. Okay, and then I did also notice that the metronidazole was at 10 a.m. So if I wanted to, I probably could give her the metronidazole because it would be within that hour before, hour after time that you were mentioning. So I guess I could give her that if I wanted to, but those were the 4 that we had today. I would properly dispose of my cups, and I would document what I gave her in the logbook and just keep track of everything like that. I would dispose of my cups and everything. I would wash my hands again because I'd probably see another patient right after this, and washing your hands is just necessary. So yeah, and that's it. So if I did bad, let me know. But thank you. Bye.